My name's Lynette Layton. I'm a family physician, and I also am a director here at Voices. Voices has been fairly inspirational for me because there's so many people that have come out of the foster system and they are working hard, trying hard, have come out of juvie sometimes and then turned their life around and gone to college. And then there are also some people that are really struggling still. And what I've found my role here has been is some people who don't really know how to navigate the medical system, or they don't have transportation in the medical system, but they all gravitate to this center. So it feels good to kind of bring the medicine that they need to the place where they already are hanging out. I think most of them get care they need more often because of it. Otherwise they would just make appointments at OLE maybe and not go because it's across town.
I was put into a group home at 13 years old. And I was introduced to Voices when I was 16 years old, and I started going to the program.
Well, if you feel like you're having a lot of ups and downs, or if you're just getting down, think about medication.
Yeah, I was thinking about that like last week when I was sat down with my girlfriend and just told her how, what I'm going through, the depression and just stress and stuff, and all the other stuff that's not helping in my life. And I thought about maybe antidepressants again, or something like that, but.
Yeah, especially if your ups and downs are getting you in trouble. When's the last time you saw somebody in therapy?
When I was on juvenile probation, so March.
I think people are trying to do so much in their lives here that it's hard for them to remember their health. And so it feels good to just walk in and provide that for them where they can be. They enjoy coming here, they have social life here, they have computers they can use, and so they're already here. And I think that's one of the things we try to do overall is bring medicine where people are to make it better. That's why we have several different sites, but this one is kind of the really key example of that.
It's easier to see OLE at Voices because it was more so like a one-stop shop, and I was able to just come here, and there's so many different programs and they don't have to go anywhere else, versus having this appointment and having that appointment and then having to go across town and come back. It's just you can handle everything right here.
Recurrent themes are just struggles with substance use, struggling with keeping themselves healthy, keeping themselves housed. That's a really big deal. And when they're not housed, it makes their health care that much more difficult. OLE is really committed to making sure they get the health care they need in a system that doesn't support them.
The reason I like going to Voices and coming to Clinical A through them is it gives me more of a sense of warmth. It makes me feel more accepted because I'm around people I know versus going to a doctor's office and not knowing anybody and just kind of having that uncomfortable feel.
The staff at OLE were very understanding, and they met me on my level and they were able to talk to me. But they were very welcoming, asked me how my day was going, and you could feel the genuineness of it all, like they really cared about how I was doing.